Hello, welcome to the interactive web-based presentation about substance abuse in pregnancy. Today we will be discussing and answering questions about the chosen leading health indicator topic and community project. As a labor and delivery nurse, I see many types of substance abuse cases as frequently as on a daily basis while working. Some cases are as common as marijuana use, while others I have seen to include cocaine and even heroin use. Sadly, sometimes drug abuse can be the direct cause of a negative outcome with pregnancy. No one deserves to have that experience, even for those who are drug addicted. I chose this topic because I felt that providing education for expectant mothers who use illicit or even over-the-counter drugs would be beneficial in helping with a positive outcome for delivery as well as subsequent pregnancies. Studies show that other than alcohol and marijuana, prescription drugs are currently the most frequently abused agents in the United States. According to Hart, Wong, Burt, Harrison, and Winter, 93.2% of deaths were associated with opioid overdose between 1995 and 2005. Of these deaths, 415 of them were pregnant women, and the drug of choice among these women were in the benzodiazepines and opioid drug classes. In pregnancy, the woman no longer just has her own health to worry about, but now the health of her unborn child. It is important for the expectant mother to be aware of the risks involved with drug use and the many ramifications on both the mother and the fetus they have, both in utero and out. An overview of the MAP-IT model includes creating a list of stakeholders with their assigned roles in the project. The role of the expectant mother is to provide feedback on the education she has received. Thus, we can verify the information given was understood. As for the patient's family, the role is to provide support for the expectant mother as well as education, thus helping the expectant mother through the process of detox. The role of the health department is to monitor statistics of mothers and newborns addicted to drugs at delivery. The hospital social worker's role is to provide referrals for rehab if needed. And the role of this student is to provide education on the use of drugs, as well as effects on the newborn, rehabilitation, and support services that are available. In order to implement this framework, priorities need to be established. Among the priorities are holding community functions on the effects of substance abuse and inviting all expectant mothers to attend. A survey of the population must be given to establish a percent of the population who are substance dependent. Education is also a major priority. The purpose of the education should focus on the wellness of the patient and not punishment, thus promoting cooperation from the patient. The steps of this process that required the most work was the formation of education materials for the patient. Many patients do not realize that the use of medications and other substances during pregnancy can have a harmful effect on their baby. For example, the use of alcohol during pregnancy can cause the development of fetal anomalies and can also be the cause of behavioral, cognitive, or neurological impairments in the fetus as well. With education, expectant mothers can not only get the correct information, but can have the chance to ask questions as well. Like any other type of evaluation, the expectation is to see an increase and a positive outcome. However, we must remember that limitations may affect the potential outcome. An example of limitations may include the following. However, in terms of educational knowledge, it would be anticipated that expectant mothers will be able to verbalize the understanding of possible risks to both mother and fetus, a decrease in the number of drug-addicted newborns, and an increase in the overall well-being of mothers and newborns. What do you consider a positive outcome? A positive outcome is considered to be, for example, if 100 expectant mothers were surveyed, and after education, at least one of them stated that the education was beneficial to them. The point of education is just that, to educate. As far as patient outcomes are concerned, education can only take a person so far in life. It would be beneficial to continue updating information and holding new community functions yearly for patients in need. However, no amount of education can help someone unless they choose to use it.
created using Powtoon.